Hey guys, welcome to my new podcast series, Your Health You Care. And today, what I'm going to present to you is a very frequently asked question. In my clinic, patients often ask, "Hey doctor, can we actually treat high blood pressure, that is hypertension? Can we just discontinue the medication for blood pressure? Can it be completely cured? Can we just reverse the hypertension, high blood pressure? Or doctor, is it that we have to take the antihypertensives forever?" So I'm going to tell you what can we do about it. The short answer to that question is yes, but yes with an asterisk, meaning conditions apply. And that I will reveal it to you in the video. Prior to that, you have to understand what is high blood pressure, hypertension, and what type of high blood pressure do you have. Did you care to ask your doctor, "Hey doctor, tell me more about my high blood pressure, what kind of high blood pressure I have?" Because actually clinically there are multiple types of hypertension. So that is to begin with the explanations, you should be curious about the exact diagnosis of your medical conditions. Now that you know, you can follow up with your doctor and talk to your doctor about what specific type of hypertension do you have. In general, there are hypertension with no known reasons, and there are hypertension with comorbidity or existing conditions, or the high blood pressure happening secondary to one existing medical problem or a medical problem. Most commonly the kidney disease, the coronary artery disease, dyslipidemia, stress and whatnot, and portal hypertension. A lot, there are many types. So first you have to go with knowing what exact type of high blood pressure do you have. Once you figure that out, job will be easier for you to work on the prevention of the hypertension. Let's say not prevention, further progression of the disease, or in certain cases to discontinue, yes, to be successfully discontinuing the antihypertensives. There are research. Actually, when I thought about bringing this topic in my talk, I also went to the Google Scholar to find some articles for you that I can discuss with you. And I want to mention one article written by Albert Sanchez et al. I made a cheat sheet for you, so I'm looking at it. Albert Sanchez et al. Published very recently in 2019, and the title of the article is Multiple Lifestyle Intervention Reverses Hypertension. Pretty convincing, right? The title itself is convincing. And then I further read about it, and the research was done on around 114 patients, and among them there were patients who were actually taking the medications for their blood pressure. There were patients who were taking medications for blood pressure along with some other medical conditions, and there were patients who just wanted to be enrolled in the study, or they were just interested in what happens. And in the research they found that there are ways you can prevent the high blood pressure from further progression and to an extent of discontinuing the medications. And now the most curious question here is how? What did they do in this study that these patients were able to reverse the, not all of them, but most of them were able to reverse the hypertension. They discontinued the medications. To be specific, let me just see, 69% of the enrolled patients were able to discontinue the medications, and 24% of the patients were able to reduce their medication intake. Pretty impressive, right? So the hypertension, the high blood pressure actually can be corrected and reversed. to your further curiosity, I would like to discuss with you that what were the lifestyle conditions and criteria they were to follow for the high blood pressure management. Again, I have to see one by one: the nutrition, exercise, alcohol, no smoking, rest, water, and fresh air, and of course sunlight. And they also included spirituality, so having faith in God. So if you really want to dig deep into that, what were the other determining factors and how were they contributing to the discontinuation of the high blood pressure, you really have to go and find this article on internet and do your own research. And before that, you should actually be following up with your doctor who you are taking medications under, and try to understand the problem, try to see what exactly is happening in your blood vessels. Do not just take it for granted, or just think that okay, high blood pressure is a forever condition and high blood pressure cannot be treated, it cannot be reversed. No, my friend, the answer here is yes, you can reverse it with a commitment and dedication. You definitely need a guidance from your family doctor or general physician or whoever you are refilling your medications with. So the high blood pressure is actually happening due to multiple other diseases also. So if you have other conditions like kidney disease, or if you have any sodium level in the body, deranged sodium levels, deranged liver function test, or you have stress and anti-anxiety medications are on, in order for you to prevent the blood pressure, you can also work with your other specialist doctors to address the causing disease for the hypertension, for the secondary hypertension cases. But for the primary and essential hypertension, you can start from day one. Just follow with your doctor and see what you can do about, again, the nutrition, the exercise, the rest, the salt intake, water in the body, stress level, environment, sunlight, and spirituality, of course, and quality of the air you are getting, kind of density you are living in, kind of mental conditions you are encountering in your day-to-day activity. But bottom line here is, yes, the high blood pressure can definitely be reversed with continued efforts. There are now you might be asking, okay doctor, so it's not that I just take, let's say, Telma AM, the telmisartan and amlodipine. You might actually also be taking some other type of antihypertensives, diuretics, you might be taking the beta blockers, you might be taking the ACE inhibitors, you might be taking the ARB, and whatnot. And so you would be wondering, oh no, this condition is actually kind of complicated now, how can we do? But you should just start following with your doctor. Talk to your doctor and talk to your doctor about how can you prevent from further progression, or to an extent of completely ceasing the medications and becoming non-hypertensive. It is all doable, and all the best. Take care, and